This podcast is intended for veterinary professionals. Whilst members of the public are welcome to listen, please note that the discussions are designed with a clinical audience in mind and may include technical or treatment-related content. If you are a pet owner with questions or concerns, we always recommend speaking directly with your own veterinary surgeon who knows your animal best. Well, hello and welcome to this episode of the Nupsala podcast. Today we're joined by Dr. Ross Allan from Roundhouse Referrals in Glasgow. Ross is an advanced practitioner in small animal surgery and has a passion for what he terms the joint organ complex, which I'm really looking forward to hearing all about. Ross graduated from Glasgow University in 2001, gaining his certificate in small animal surgery in 2014 and his advanced practitioner status in 2015. Ross is the clinical director of referrals at Pets and Vets in Glasgow, where he leads Roundhouse Referrals, and treats many lame dogs with orthopaedic injuries, as well as developing the collaborative owner and team vet management of osteoarthritis patients. So Ross is also a member of the regulatory group for the Veterinary Osteoarthritis Alliance, and I first met you down at Harper Adams, where we were hosting the Nupsala intra-articular injection CPD. So welcome, Ross, to the podcast, and thank you very much for coming on.
Well, thanks for having me, Meg. I'm delighted to have the opportunity to join you and hopefully spread the word about improving the management of our osteoarthritic patients.
Fabulous. So, as I just mentioned, we first met down at Harper Adams, where Nupsala were hosting these intra-articular injection CPD courses, and you very kindly came down and as one of the speakers. And we had a lot of interest in those courses. And the feedback afterwards was absolutely fantastic from the theory and the practical sessions that they had. And so I just wanted to kind of start with this topic, really, of how important is a knowledge for the general practitioner in first opinion practice. How important is this knowledge of this intra-articular pathology, the diagnostics, the therapeutics, in order to manage their OA patients?
Right. There's no doubt that in terms of osteoarthritis itself and in terms of the diagnosis, the pathology and therapeutics, this is a really important subject for all vets and practices of all shapes and sizes, and in terms of all practices throughout the country, as it were. So we know that the incidence of osteoarthritis is definitely over 20% of dogs over 1 year old and probably over 80% of dogs over 8 years old. So this is a really frequent and common presentation in general practice. Many of these owners will be worried about their pet, how they're lame or stiff or sore. And definitely, it's our responsibility as vets and as a team in general practice to be able to manage these patients adequately. And certainly, I think it's something that, we all know general practice is busy, it's time consuming, there's things on the go, there's always other expectations and other demands, and making the time to care for our osteoarthritic patients, I think is something we really need to try and do a little bit better, maybe I have done historically. So that's what's kind of drawn me towards my interest in osteoarthritis and something that I'm keen to develop and play a part in developing in the years ahead.
So you mentioned, or in your bio, it mentions this collaborative approach that you have. Can you just tell us a little bit more about that?
Certainly. So, like many people in practice, there's only one of me, and there's a lot of patients, so there's a lot of expectations. And in terms of delivering care, we've worked really hard on, how we can do that as a team and a collaborative approach. So, I'm fortunate. I work in quite a small team, but a highly motivated team where I've got a nurse, I've got PCAs, I've got physio colleagues who are all able to input into the patients that I'm looking after. Whilst we've still got limitations, both in terms of practicalities like time or people's, the number of days they're in work, whilst we all take different days off and there are these kind of challenges, what we've worked hard to put into place is systems and processes that mean that collectively we're managing these patients way better than any of us can do alone. And that's definitely something that I think currently is still underutilized in general practice overall, but I think osteoarthritis specifically offers a really good, almost like model to see how we can innovate and how we can develop these systems and teams within practices of different sizes, and then hopefully use those systems to improve the management of all diseases. But let's start with osteoarthritis. It's a good one to start with in many ways.
Yeah, as you mentioned, those statistics, they're really high, aren't they? So this is happening to, in your lifetime of owning pets, you're highly likely to have at least one arthritic pet, if not several. So it's going to be affecting all pet owners at some point. So when we talk about intra-articular therapies, what do we mean by that, and what would you be using in practice?
Okay, so there's definitely increasing interest in terms of intra-articular therapeutics, and this probably comes about from, I think there's probably different factors like in the ecosystem, if you like, that are increasing our awareness and our interest in these products and these materials. So I think, historically in the equine world, these have been around certainly for the last 5, 10, probably 15 years. These are things that vets that are working in that arena are definitely very familiar with. Horse owners are familiar with as well, but there's definitely been a historical kind of caution, reluctance, wariness about even considering their use in small animals, probably for a couple of reasons. We might come back to that. I definitely also think that there has been an innovation in terms of the products that are available. So that's definitely opening people's eyes to, more options and also more availability. There are definitely more options and availability of products to treat, intra-articularly, as it were. In terms of the reluctance to treat, or it's maybe more the caution to treat, I think it's just that for vets in small animal general practice, it's still uncommon, or there's an unrequired fear. I don't know if that's the right phrase, but unrequired fear to put a needle into a joint. People are very cautious about doing that. If that's not something you're doing repeatedly or regularly, you are concerned about doing that. And what I would definitely say on this podcast, and definitely at the wet lab we did as well, is about the importance of not being fearful of doing this, about the real amazing value from taking intra-articular samples for diagnostic purposes, and also about the amazingly powerful scope for administering intra-articulars, which definitely can make a significant difference for some patients and for specific purposes. So I would definitely urge all vets in practice, if they're not feeling confident to do intra-articular injections or to take joint fluid samples, definitely to look into attending a course like the one we ran, Meg.
Yeah, absolutely. And so are there any other tips that you could offer vets who are kind of wanting to get started on this but still a little bit hesitant? Obviously, you mentioned if we can get on a physical course, that would be the best idea. Is there anything else that you could suggest?
Right, there's definitely an increase in amount of resources online. So as you mentioned, I'm involved in VOA, so we've definitely got resources online for members that are taking part in VOA as part of the education resources that we've got about intra-articulars and about also joint fluid sampling as a diagnostic tool. So there's those resources. Many of the products that are in the market also have got quite expansive resources about the use of their products and about the indications or their experience of using those products. So I think getting sight of them is useful, and also speaking to the teams that are distributing these products, definitely something I would suggest. I mean, in terms of products in the market, this is where I think you asked that question earlier, Megan. I didn't answer it, did I? So that's where there are a number of products I think that some of us will be more familiar with, but this is continually developing. So in terms of the main groups, the main groups probably are to do, first of all, with orthobiologics, and then to do with some more kind of off-the-shelf solutions. So and along with that, we've got others that have been around for longer, such as intra-articular steroids. They're something that people might be more familiar with, and certainly in general practice, you'll be familiar with them for other purposes, as it were. So each of these have advantages and disadvantages. So it might be in terms of the time, it might be in terms of the capital investment and the equipment. It might be in terms of whether or not it takes time to process things. You need to learn a new procedure, and that can be quite challenging, or a little bit challenging without some practice. But each of these does definitely have advantages as well as disadvantages. So I think in terms of getting into this, I think the practical course is really useful. And then it's probably, or maybe, at the time of the course or through speaking to people such as yourself, Meg, identifying one or two of these products that might be the ones that you're interested in using. I think it's very unlikely somebody's going to be interested in using the whole number that are available from day one. It's more about developing understanding and then from taking it on from there.
Yeah, okay. And so why do you think joint injections have become more popular? As you say, in equine, they're used extensively. Very few vets wouldn't know about a joint injection for horses. But in a small animal, as you said earlier, it's been a little bit slow to catch on. So what are the advantages of going intra-articular rather than a systemic treatment, for example?
So I think in terms of in small animal practice, I think it's partly this previous caution about administering anything intra-articular when people haven't been familiar with it, unlike equine. I think also the products probably historically have not been directly developed for the small animal market, as it were. I think a factor in the overall interest in these products is partly to do with human health. There's no doubt about this. So in terms of an aging population globally, there's far more awareness and genuine concern in human healthcare that not everybody that might historically have got a hip replacement or a knee replacement might be able to get that. So many of these products in the human space are being developed as something that might remove the need for some of those more invasive and more expensive treatments, but might also delay the need to perform them if required. And that's partly to do with the general economy and how much healthcare costs, and trying to make sure people are comfortable and pain-free and can live a meaningful life without necessarily having to have surgery. So that's part of these are the factors around the increased interest in intra-articulars. And I think another reason is the genuine awareness that not all patients do well on non-steroidals or anti-inflammatories or some of the more traditional painkillers. And also many of these drugs, the ones that we're familiar with and some of the newer innovations do have side effects or concerns, that meaning people really need to think twice about before choosing them. And certainly the longer term use of them might be something people are cautious about. So whilst my experience is that intra-articulars are not likely to be the single panacea that's going to treat and cure lameness necessarily, they do definitely offer another alternate way of trying to improve that patient's individual comfort. And that might be for the longer term, or that might be to kind of reset the inflammation and the discomfort in their joint and make them more comfortable, so that maybe they can embark on a more comprehensive rehab and management plan, which often is the thing that they really need longer term to improve their mobility and their comfort levels. So I think the way that I think of these kind of intra-articular medications is not as a panacea, but as a tool along with multiple other factors to hopefully improve the overall patient management plan.
Yeah, okay. So where, if you could give us like a case example from the first time you see, let's use a Labrador because they're a common breed to get arthritis, and the one that you might see quite often.
So, yeah. So if we take an example of a patient such as a Labrador with elbow dysplasia, an early OA, then there's probably multiple factors that can help that patient. And I think the simple things shouldn't be overlooked. So things such as managing their weight. We know that patients that lose around about 8% of their body weight will get as much benefit as being on a non-steroidal. And we really shouldn't neglect the importance of proactive weight management and weight loss. I think in terms of their general comfort, adapting their lifestyle or their surroundings to make them comfortable, modifying their exercise. These are all simple things which take time to explain well to an owner and definitely require effort in terms of maintaining those changes that can be of meaningful benefit, but they definitely can be of a significant benefit. In terms of elbow arthritis in a Labrador, it's a simple kind of example, but it's also so complex in that there are some of these patients that will benefit from the likes of arthroscopy, removal of fragments. But there's also a proportion of these patients which, even if you remove a fragment and help improve their comfort to some degree through doing that, will still have incongruity within their elbow that's not going to be improved by just removing the fragment. And that's where there is increased interest in some of these intra-articular products for those patients. And that's partly to kind of reset the inflammatory cycle within the joint, maybe through using orthobiologics, and that might involve stem cells or PRP or things like that, or whether or not those are patients that might benefit from products such as Arthrimid, which is maybe more about, there's different arguments whether or not that's a physical benefit, or increasingly I think there's a suggestion that's to do with the discomfort that is felt from within the joint, as it were. So there are these different tools, but they should augment the rest of the management plan rather than being the sole therapeutic.
Yeah, okay, I can understand that. So let's get into the joint organ concept then. So can you tell us what it is, why you find it helpful, and how your knowledge of that helps you to treat these patients?
Right. So this came about, probably I am a visual person, and also I've worked with some very talented people who also happen to be arty, and I've got connections in that world myself. So in terms of many of these products seem to come from a lab and have quite a good story, but understanding that and actually making that something that I can easily understand, and certainly the public could understand, I think we need to try and simplify these things. So in terms of the joint organ, the first thing about the joint organ concept is that, I think, being honest, Megan, I think historically I didn't think of joints as being organs. This seemed a bit far out there, but this philosophy, this isn't something I've written myself. This is something that has been around in human health for probably about 15 to 20 years, but has been, as yet, I think, poorly used in vet medicine. So basically, the definition of an organ is a group of cells of different types, but serving or providing a shared function. So a group of cells providing this shared function, work collectively. So we think of organs, we think of the liver, we think of the kidneys. These are definitely, we can imagine these cells. We've been taught them at uni or at college, and we'll be aware of that. They'll do different things. But when we look at joints, such as the elbow or any sort of diarthroidal synovial joint, there are also a group of cells there that are doing different things, but working collectively. So in the joint organ concept, and what this developed into was the emojis to help illustrate the joint organ concept. So we have the cartilage, it's in there, it's kind of anucleate, it's the lubricating cartilage. We've got the synovium, which increasingly there's kind of a high likelihood that is the key factor in driving inflammation within joints, as well as driving the kind of nociceptive pain element of arthritic disease. We've got subchondral bone that's below the cartilage. We've got the joint fluid itself. So there's these different elements that are playing a part in the joint. So they are the joint organ, and they're working together. And when osteoarthritis starts and then when it progresses, each of these elements change. So the emojis that came off the back of this was to kind of characterize these individual tissues, to give them a face, to let them show their emotion as they get upset and angry with osteoarthritis as it develops. And so how, for example, the synovial fluid loses its viscosity and it gets thinner and it looks sad, or the axons, or the nerves that are growing into the synovium, those axons, they're the one I missed out earlier, those axons grow more kind of axons off them, and they'll help to circulate or nocicept more, hence increasing the risk of wind up and pain and things like that. And we've also got the cartilage. It starts off smooth, cool, happy, but then gets kind of fibrillated, grumpy, morose, upset, sad, things like that. So it's these different cells working together. So that's the joint organ concept and the OA emojis. Yeah.
Fantastic. Yes, I remember seeing the t-shirts that you produced for some of our delegates at the course, and yes, they went down very well.
They went down well, and I think they're not. I think they might be collectible already, Meg, because I think there's already been a first edition, a second edition, and I've actually heard that some people have given them to their kids to wear as pajamas or something. I don't quite know, but they're definitely collectible. Yeah.
Well, that's, passing the joint organ concept down the generations, though,
That's
isn't
it.
it? It's going to
Indeed.
stay with them. That's fun. Yeah, absolutely brilliant. And I'm a visual person as well, and having seen those emojis and the way that is described, really does help to bring that concept together and make joints come alive, as it were. They're not just ball and socket, mechanical, inert, entities. They
No,
are living, breathing cells that
they're cells,
interact with each
absolutely.
other.
Yeah, they're cells, and they're a whole, like, complex system, which in some academic papers involves lots of arrows and lots of acronyms, and four-letter acronyms and a few numbers on there, and it's just so confusing. And part of this, and the reason for developing the emojis, is to open up the discussion and maybe make it a little bit more accessible, to maybe start to understand a bit more about how products such as intra-articulars might act on certain elements of this, but then that has a kind of synergistic benefit on the other components of the joint organ. So I think that I've certainly found that useful, and it's good to hear others have as well.
And have you used this way of explaining the joints with your clients, with your dog owners? How have they found it?
I've not worn the t-shirt in a consult room quite yet, but stranger things have happened. I think I like consulting. I've not used the emojis in the consult room yet, but a time will come, I'm sure. But certainly in terms of anything I'm explaining, and I'm largely like a surgeon, I'm mainly doing surgery of one form or other. I mean, I think definitely owners, many of them also are more visual, so they want to see examples. So certainly I've got my models of the joints that I take into every consult. I've got the models of before and after, common surgery like TPLO, to show them what it looks like, so they can actually hold it and see what it looks like. Because I think that definitely, rather than being like two-dimensional black and white x-ray, when they can actually see, for example, an elbow joint with arthritis and feel the knobbly bits and the thickened out bits compared to a normal elbow. There are these plastic models that are available to illustrate that. That's definitely something that helps owners understand and appreciate the severity, but also the kind of three-dimensional nature of the disease. And I think any tools like these, are really, really useful. We all start to use the kind of same phrases, but also the same images to explain things, and working on that and trying to make it better and easier is definitely something that I find rewarding. Yeah.
Okay. So you first brought out the emojis at the Veterinary Osteoarthritis Alliance conference a year or so ago. And what might you be bringing to the conference this year?
Right. Well, this year, I'm looking forward to VOACON 2026. So in terms of this year, so there's a few lectures I've got lined up. So there's going to be one about to do with. So the VOACON, what's great about it is it's bringing together everybody that might be involved in the care of our osteoarthritic patients. So there's vets, nurses, physios, and others that are involved. And in terms of one thing that I think we could all benefit from would be understanding more and more about this 3D anatomy. And this is particularly maybe for those that are not as familiar with it. So I'm looking forward to delivering a bit of a seminar about that. There's also, a common cause of lameness is cruciate disease, but it's often we neglect the contralateral limb, so the other limb, the limb they're not limping on, and what we should be doing to help manage that, and about the risks for issues in that leg, and different ways of addressing that. So that's the second one. And the third topic is another thing that has been important to me over the last few years and going forwards, which is to do with using QI. So QI is quality improvement. And an initiative I've been involved with for a few years now is the Royal College of Veterinary Surgeons Cruciate Registry. So this is to track the management and the rehabilitation and the recovery of patients that undergo cruciate ligament surgery. So currently there's about 2,500 dogs that are enrolled in this registry. And what this is about is using real world data. So this isn't data from a lab or from a purely academic institute. This is using real world data, both that clinicians like myself put in, but also pet owners put in. And that's to inform and improve the management of all patients that get cruciate ligament surgery in the future. And there are things about this that definitely I think could and probably should, I'll say that, be more used in managing OA. Because currently there's lots of products, there's lots of ideas, but probably we do need to more look about what works well and take into account the real world and things like that. So I'm looking forward to having a discussion about that.
Yeah. How do vets get involved with that project?
Right. So so RCVS Knowledge Cruciate Registry is free to take part for any vet. We want vets of all sorts to take part, whether or not you're a certificate holder, diploma holder, but absolutely every and any vet is invited and it's free to take part. And it's definitely an initiative which is kind of fulfilling for vets and for the team that you work as part of, but also owners love to take part. So my normal chat is to say to wee Mrs. Smith, do you want a chance for Peggy to change the world for dogs in the future that undergo similar surgery to what she's having done tomorrow? It's free to take part, and it would be a really rewarding thing for you to do, and it would make me proud and pleased as well. And no owner ever says no. They all want to take part, right? So all you need to do is go to RCVS Knowledge, and there's a sign-up box to take part.
Okay. And so what's the involvement then from the pet owner?
Right. So the way it works is it's the client journey or the pathway. It's words like that. So what happens, or the way that I do it, is I would enroll the patient, which doesn't take too long, maybe about 10 seconds to enroll them. And then the owner is sent some automated communications to complete the sign up, GDPR compliant, of course, and then to input their own patient information. And then from then on, what's clever about it is it's automatic. So the vet or the vet team don't need to send out the questionnaires that are mainly used to run the registry. They're automated, they're sent out to the owner, and the owner will complete their questionnaire. So it uses both load and CBPI questionnaires to track the recovery. And there are other questions to do with customer satisfaction and the value of the service and things like that as well. So that's what the owners put in, whereas clinicians, we put in the information about the clinical assessment, but also about the surgery we perform, what goes well, and any complications that arise. And that's also something owners can feed in as well. So it should be that real world data of what works for the owner as well as for the clinical team.
Yeah, fantastic. And do you do that just immediately following the surgery, or is that there's, I presume there's some follow-up?
So this, the way it works is that I enroll them all at the time of the consult. So it takes about literally 30 to 40 seconds to do my sales chat. To encourage them to take part. And then it takes about 5 seconds to sign them up. After that, everything is automatic, as in the owner will be sent the things they need to do. For the clinical team, what we need to put in, or I will put in after that, is about the clinical exam and about the surgical procedure itself. But that's normally straightforward. That takes maybe about 2 minutes at the most. And thereafter, it's more or less automatic. What is important is the owner gets reminders. Have they noticed a complication? Is there any concern about it? Then they can log that. The clinical team, we need to do that as well. So if we see that patient back and it's got a wound infection, for example, or there's some other complications in the surgery, in the result of the surgery, we should log that upon the registry. But that doesn't take long to do either. It's straightforward and simple.
Yeah. It sounds like a really important initiative, and it's almost, following a kind of pharmaceutical pharmacovigilance model to track adverse events, for example, where we have a lot of data on that kind of pharmacological side, but yes, not with surgery. So how do you think that it's going to help kind of in the future help with this knowledge?
So you're totally right. This is similar to many initiatives that are in human healthcare. So there's certainly registries for hip surgery in humans, for knee surgery, for ankle surgery, elbows, I think most joints, and many other clinical conditions, not only surgical and not only orthopedic. So I think that real world data has definitely in human health uncovered some, really novel findings that have transformed the management of specific conditions. So the one that comes to mind is in human ankle surgery. There were certain fractures that used to be non-surgical, but through collecting real world data, they showed that the outcomes were far better if they were treated surgically. So that changed how somebody would be treated now compared to, I think, 10, 15 years ago, and changed long-term how that individual patient would do. And that occurred not due to cutting-edge clinical research, that occurred due to collecting that real-world data. So I think that's, for the Cruciate Registry, I hope it does improve cruciate treatment in a similar way. In terms of osteoarthritis and QI, I think there's definitely opportunities to kind of, discuss and decide between us what matters most and what can make a big difference. There's lots of opinions. There is some evidence. There's quite a lot of pharma. There's quite a lot of anecdotes. We need to try and shake this out a bit. And I think it's kind of our responsibility, and one of my interests in VOA is to try and do this a bit more over the next sort of 5 years or so.
Yes, yeah. We have so many resources available to us, but pinning it down to having a little bit more of a tighter protocol, or just knowing what's actually going to help those patients is going to be really important. So I look forward to your lecture at the VOA. Well, thank you very much for joining me today. It's been really interesting to talk to you, and I said the joint organ concept is something that will always stick in my mind, but it actually made me think of your team working together as an organ within the practice, and everybody has their part.
Absolutely.
And if one part doesn't work, then it puts strain on the other parts. So that's the image that I had in my head whilst you were speaking. Yeah, we'll have to do emojis for your team next.
Maybe need to do that. Yeah, but thanks. That you're totally right. I mean, that's what's out there for osteoarthritis management, is this collective opportunity to improve patient care. So brilliant. Yeah.
Wonderful. Well, thank you very much for joining us, and hopefully catch up with you soon. Thanks for tuning in to the Nupsala podcast. This is one of many insightful episodes that we have in store for you. You can stream the episodes on Spotify, Apple Podcasts and Amazon Music. Simply search the Nupsala podcast. You can also watch on YouTube or directly at nupsala-learning.co.uk. If you'd like to stay up to date with all our latest content, please follow us on social media, where we always post when a new episode launches. All the links and details are in the bio. Thank you.